Greetings and welcome to EHA Unplugged, the official podcast channel of the European Hematology Association EHA. This is a special Lighting the Flame edition where we talk to some of our promising and active members in the hematology community. Our guests in this podcast series have volunteered their time to attend and facilitate the Lighting the Flame program where they mentor young trainees and medical students in their field of hematology. In this podcast series, they talk about their experiences in their field and give advice to those who are interested in becoming a hematologist. So sit back and enjoy the podcast. Disclaimer: this interview was recorded outdoors during the Lighting the Flame workshop in Romania, in a wonderful location next to the fields and forest. Therefore, you may hear some cricket noises in the background.
So welcome to this Lighting the Flame session. So we're going to talk about how to get started with a research project, how to get funding, how to apply for grants, and how to develop your research project. So I'm Kirsten Grønbæk. I'm a professor of hematology from Rigshospitalet in Copenhagen. I'm an MD PhD, so I'm seeing patients and having a lab on the site. And we have...
I am Paola Martelli. I am a hematologist as well as MD and PhD. I am the director of the Hematology Institute in Perugian University in Italy, and I have also a research laboratory, translational research laboratory on acute myeloid leukemia.
Yeah. I'm Simona Valletta. I'm a group leader at the University of Manchester. I'm the lead of the Leukemia Study School. And I'm just a scientist, so I'm just a group leader. I have a PhD in Hematology.
And I'm Anastasia Conti, a senior postdoctoral researcher at the San Raffaele Teleton Institute for Gene Therapy in Milan, Italy. And I'm a PhD, and I'm working on a gene therapy field and also in acute myeloid leukemia to know better the molecular mechanism behind this pathology.
Thank you so much. So I think to start up with this, so if you are a young student or early doctor, how should you come up with a research idea? Should you come up with your own idea? Should you go and contact a PI? What would be your suggestion?
So the idea, I think, that comes during your experience, that you have either taking care of the patient and follow the outcome of the patients with a cancer or anyway the hematological malignancy, so other diseases that you follow, and you start to make a question to yourself why the patient is not responding well to the therapy, why the patients had higher toxicity than the other, and the others are going very well. So you start to make the questions and that everybody is doing, and then you try also to find an answer, and the collaboration of people around you to try to get an idea, and probably also by yourself. It can go by yourself, observing a phenomenon, for example, that is happening in the bone marrow of a patient while he is doing or she is doing a particular target therapy, for example. Or vice versa. If you work in the laboratory, you see something that at certain point you connect to a clinical data. Yes, this is at least my experience, because I am a physician, a medical doctor, and doing research in the laboratory. So.
Both sides.
Yes, I did. I from the bench to the bedside and vice versa.
Yeah.
So the ideas comes on both sides.
Yeah. But for a young person, would that be so easy, or would you be guiding the young person, please think?
The young person need a guide, of course. Need a mentor.
Yeah.
Need to make mistakes also. To have the experience and make mistakes.
Yes.
To have the freedom also a little bit to work, and not only to do what the MBI did think.
And it has to
Do
realize their own ideas to be. Yeah. So what do you think?
I think I'm not an MD, so I have an idea of the career of the scientist. And I think obviously you do your bachelor, and then during your master, and mostly during your PhD, you know what's happening in the lab. You start working on something, and in that case, it's basically you decide maybe the topics, but then you work in a lab, and the idea comes from the PI. And I think during the PhD is the time when you really think and have an idea of what you are interested in. Then that idea becomes, the topic that you want to work on also later on. And then at that point, you can decide to develop your idea and get in touch with a PI that is kind of covering that field and say, I may try to find some funding and come there, but I would like to work on this, and that. And that's very interesting because you are coming with an idea. But you can also just contact someone that is working in that field and say, I've seen you work in AML and I've seen that you work in microenvironment. Would you have some space for me to work? Which are the projects that are available? So I think it's like, it can have different paths, but you need to pick something that you are interested in.
Yeah.
Because then this is the lead that's going to
driving.
Always. Basically, that's what I think. Yeah.
Yeah, I agree. I totally agree. Actually, as a scientist, I also think that maybe during the master degree, you had the chance to find, something that particularly interested you during your classes. And that's what happened, at least to me. And then, so if you like the professor and like the topic, maybe this can drive you to the decision of, attending the lab of that professor, for example. And so I think the first choice becomes from that. Then I agree with Simona, after the master, maybe you are more conscious of what is the normal lab daily life. Maybe you become more conscious also about the science behind your project. And so you are able to distinguish if you really like what you are doing, or you have many possibilities also attending congresses and meeting more people to see, okay, maybe I like actually what I want and I want to have a deeper background on it, or I want to change, maybe attending another lab or something like this. So yeah, the first choice, at least for my experience, is based on what you are interested in during your classes.
Yeah.
And then and it's a
Flows from that.
Yeah.
I think we're already touching about it, but once you've chosen your subject, and then how will you develop a project? I mean, what's the important things to take in?
To develop a project,
Yeah.
I think that you have to have clearly in mind your question. So the biological question, considering PhD training, let's say, that it's really behind your research project. And so this is the key for me. Then, of course, you will have tools that can support you in addressing what is your biological question. And then, maybe also the sharing of ideas with other guys in your laboratory during conferences will also guide you in pursuing the project, extending techniques, new approaches. But yes, the key for me, at least, is the biological question has to be clear and precise. And this is what I said also yesterday, because I had this topic. So how to get your first research project, right? And and also I think another important stuff is the support that your PI and supervisor can give you.
Oh yeah.
Because of course, maybe you have clearly in mind the idea, and I agree, especially during a PhD or master training, basically the idea, the beginning of the project is by your supervisor. So the continuous sharing of what you are saying, the results you have with the supervisor also are key in developing the project.
Yeah.
So
What do you think?
developing research ideas.
Yes, develop. Yeah. So you have an idea, no, what to develop a project, but
I think it's kind of, you need to have in mind, yes, which is your question, a big question, what I want to address. You need to read what has been done in the field, because obviously you want to.
so what is the background and not repeating also?
What people have done already, what people have done and didn't work. So you want to try to find the right methods, the right approach, and maybe something new, using new technologies. We need to be updated with everything basically it's going on. And that just prepare plans of things that you want to do and follow, start.
Yeah.
I think everything starts probably from preliminary data that you have, and then you get a direction. We know that in science you get a direction and then maybe
And then you
it's not what. And you change completely. But at least at the beginning you have a plan. But the plan may change if like I'm gonna do this, and that, and then this is coming out. Probably that will not be the outcome. But having a plan at the beginning is very important. Knowing what has been done already, because you want to finish with something that you can publish, that you can present, think that is something that is interesting.
Feel forward.
That then helps you going on and extend the knowledge. Or
So what about, because it's a little bit different maybe with what we're doing, like translational research. So how do you develop those projects? I mean,
I think that is not so much different to plan your research when you have an idea. You can have different issues. If you have a clinical research, then a laboratory research with anyway you are. You have to address like ethic issues that are very important and see whether your AI is compatible with ethic issues for patients, or any way you want to use of particularly patient sample. Patient samples. But the process is the same, absolutely. I agree that literature background is fundamental, and you need to use that literature, that background, to demonstrate that your idea is new, is innovative, and that your idea goes to fill the gap that you have in the field of the research. So also in writing, for example, your proposal. When you have an idea and want to get funded, you need to propose the literature that support your idea as innovative. And then the plan is difficult because it requires experience. So you can ask help of your supervisor or your colleagues. It is very important to have discussion, sharing the idea, and have also a judge from other people.
So thinking, so if you should advise maybe somebody who wanted to start a PhD or master's, what would you say to them that they should expect during this period they go? I mean, if you want to prepare them a little bit, they come very happy now. I'm starting my research project.
My advice is that they carefully decide in their research project, actually, because a PhD is a period of training that, depending on the country, is 3-4 years, in US 6 years. So I think that the basis, they have to be convinced of what they are deciding, and the project, of course, will be the project that most likely they will follow for that time.
Yeah.
So they have to be very convinced at the beginning. Then another thing that I have to say is that, of course, as the girls were saying, research is made most of the time of failures, let's say, is in general. So they have to be motivated, resilient, persistent, and actually they have to be trained for this, and also have clearly in mind that science is also made of collaboration. So they have to be, they have to have a team working attitude, to be prone to collaborate, also to travel. Because I think the great thing of science is that we are continuously sharing ideas with other people. I don't know if we want to move to another lab to learn some techniques, we can go. So yes, they have to be ready what the PhD will be actually.
Yeah. So feedback to someone that wants to start the PhD.
Yeah.
You say expectations. I think whatever you can expect, a PhD is never, you cannot predict what's going to happen. I mean, it's a unique journey, and I think it's fun and not fun sometimes, but you need just to enjoy your journey. That is going to be unique. No one has the PhD that is exactly like the other one. It gives you a lot of good things, traveling, networking, science. Sometimes you have bad day, good day, it doesn't matter, but it's, enjoy it. It's very important, but just decide strategically which is the lab where you want to be, because, you are investing a lot of your time in a PhD. You want to that's something you can look at, that is deciding which lab you want to do the PhD. It's 3 years, 4 years, as she was saying, so you can enjoy the path, but if you can at least look at something is, strategically, and be sure that you're going to have a good environment, to find a good place, and relationship with your mentor or PI is very important. It's going to, it's going to be there every day. So these are the things, but don't expect anything. Everything can happen. Just start it and enjoy it, and then happen.
Yeah.
Yes, I agree with my colleagues, of course, because also for my experience, I did that because I went for a PhD thinking to do something, and then I realized that I was doing something else. So idea and the plan, completely your plan, because anyway is very good experience, because you start to deal with what the research, the bench research is, the question of the research are. So whether you do basic research or you do more translational research, the approach anyway to the work and what how you grow is important. For example, I did a PhD in lymphocyte cell signaling, so very basic. Then I'm doing translational research on acute myeloid leukemia. But all I learned was really, really important. The method.
So you'll be using this as all
the method. So don't be scared if you change, for example, the topic of your research at certain point in your life. It's everything it was useful for.
I actually think this is also a very interesting discussion, because I have colleagues that say, "Oh, it's a waste of time to do MD, right? That's a waste of time to do a PhD. I mean, you're not going to. Do you think it's a waste of time, even though you don't get the Nature paper or Blood paper? Maybe you gain us more."
Absolutely.
I think I had a very huge experience. It shapes you as a scientist. It's a training.
It's a training. It's an education, right? It's an extra education.
That makes you understand how science works, how to approach, that things may not go as you predict. It just shapes you as a scientist. And, it's that.
I even think as a doctor now, I even think as a doctor, because, you have a different way maybe of seeing the new drugs coming now. I mean, you can critically evaluate how.
Understand the diagnostic procedures that are more and more complex.
Exactly. Yeah, that's real. So
I see the difference between medical doctor that do not have experience in the laboratory, they have difficulty sometimes to interpret in the results of the diagnostic. They're more dependent.
And of course, I think there's a space for everybody. It's not. I mean, it's also good. I mean, if you see patients every day, you might also be better at that. But I think it's so important that we at least have some in the departments of hematology who really spend important time also.
Yeah. I think it's very good because actually if you have a clinical background and education and you can also combine it with a PhD, basically you are able to understand the molecular mechanism behind the disease. You know perfectly the disease phenotype, and so maybe you can also have the possibility to decide how to move, being more cautious of what is the phenotype.
Maybe also get good ideas in a way. Yeah, that you can then discuss in the basic sciences. That's part
of course, yeah. But for sure you have a broader, background to, this can help you.
Different background.
Yeah.
Yeah, but so what would you say to the young person? How would the person know it was a good idea for this person to do a PhD? I mean, what would be your advice? Should I do a PhD or should I not? How should I find out?
But do you mean for a master degree person or an MD?
Both. You can say, but then you can take the master and you can take the.
Okay. No, I think that for a master student, actually, it's the right way to complete the education training, basically. So in this case,
no matter where they want to work afterwards.
Yes, I think so, because after the master degree is actually, from my point of view, it's better to complete your educational training with a PhD. Just also to understand if you want to continue in this path, or if, for example, you are not interested in it, and so maybe there is something outside for you. But I think that for sure the PhD is a period of your life in which you can grow up, but not just scientifically speaking, but also as a person. Because this is, I think, a training also for your personality.
There's so many different aspects.
Exactly.
Because it's actually a training. It's
a training, but not only becoming more conscious about what is science, and so to be more confident in what you are doing, professionally speaking, but also personally speaking, because you have to face many troubles during the journey. You have to spend several years in this training, and as we were discussing, most of the time you have to face something that is not what you expected, but overall I think it's personally speaking also a great experience of life that I strongly recommend.
So should nobody just do a master's and then go in the industry? Or what do you think?
I think it depends a lot on your long-term plan, because it's a very good experience that makes you grow, but sometimes it's not required. You're able for something else. You want to make sure you use your time in the best. So if you think you actually don't want to stay in academia, or the PhD is not really needed, or you are not done to do a PhD, because it's also personal choice. I can tell you what you can expect, and you can tell me, I don't think I'm going to do that. I think that's not for me. That's absolutely a choice. We can suggest and we can share experience, but then you are going through that for 4 years. So I think if you know that you want to be in academia, and sometimes also if you want to change and be in a company, having a PhD is very important. As a scientist, it gives you a lot, because you learn basically everything during your PhD. And I think it's, key. But if you think that's not going to be useful for you, and you don't really fit with the academia world, with being in the lab all the day, with being, a bit stressed, you are not really coping with someone telling you what to do and things that don't work, maybe that's not the right way. Just follow what you think is the right way. And, there is not just one way to get.
It would be very
to get to the absolutely, you can have a goal, just try to get to what you get you there, and it's not, something that you have to do. If you think that's the best thing to, and also if you are doing a PhD and you think it's not the right thing, don't be afraid to just lose off of it. I mean, it's
better to
right?
never waste your time.
Oh yeah, when I say you have the freedom to decide, to change direction, like we were saying about the topic, you have the freedom in this field. I mean, it's more challenging when you have a background in something else to change completely. But it's also rewarding. And the same is with the PhD. Maybe you realize at some point that's not life you want to do. Just change. You have the power to do that. So.
What do you think with the MDs? How many MDs should do a PhD in your department? What would you advise? What would you advise? Would your
Also for also of course with medical doctor degrees, you need to be interested in doing research. So not all the people are interested in doing research. Just to be a physician, for example. But for example, physicians that want to be also researcher, medical scientists, I generally suggest, at least for how things are going in Italy, to do before the specialization. Yeah. For example, if you have already decided that this is your will be your life, because you have a passion for that kind of studies, so that then the PhD can be oriented to the kind of research that is in the field. When you start to know very well clinically the pathology, the malignancies or whatever, the other pathologies that you want then to study, to research on, and so on. So I suggest to my students to do the specialization, and then if they are interested, we can offer the PhD. Also take that back to the clinic and decide whether to do only clinics or try to do most. Anyway, there is the advantages that we discussed before to have an experience.
So I don't know how it is in Italy, but with us, I think it means a lot for they will sort of get to a higher salary at a later point, for example, if they do a PhD. I mean, is that anything, are people aware of that, and does it play a role? Or
so the PhD sometimes is, play a role, for example, for the access to some position, academic position. They give you points. So for associate professor, for assistant professor positions, and then
there is some points, obviously.
Yes, to have a PhD is
mandatory or
mandatory, more than the specialization. Yeah.
I think it's right, because actually there is it's an additional.
There's a training, sure. Yeah, sure. And also you need it if you want to be a supervisor for others too. So no, I was actually talking about the other issue, at least where I come from. They will get much older before they get their permanent position because they're doing a PhD. And actually some people think it takes too long time. It's an interesting, but the more, I mean, it's an investment, I think, in the future. I don't know.
It's an investment, and to get the permanent position,
exactly.
It takes time. So you can use time doing specialization, PhD, specialization, and so on. Then you can get the stable position.
But also what I usually say to them, it's not about getting the final position, because it's a way getting there that's the most interesting. Yes, in my opinion, because once you're sitting there doing the same thing the next 30 years. Anyway. Okay, I think we need to talk about another big issue for everyone that wants to do research, and it's how to get grants. Can you get some good examples? I mean, how can you advise with respect to where to search for grants and how to get grants? Also, I mean, you're probably also sitting in granting bodies. Can you say a little bit about what's important about when you write grants?
Yes, I think the most important thing is just to know how to write. So starting from this basic point, and indeed there are a lot of grant writing courses, for example, so EHA will promote this, so this is the first step, I think. And according to this, also to ask, for example, people who have more experience in grant writing, how to do, or in their grant, if they share with you, also ask your supervisor. So yes, I think sharing also in this case, it's very important. And then I think that is just a matter of experience, right? So of course, at the beginning, for sure, it will be more difficult to write a grant and then to get it. And then, along your journey, will be more confident in writing grants. And so it will be easier. I think grant writing and searching for funding actually is very, very important in our work. Because it takes a long time, yes. It's a long journey, yes, but yes, so actually it's something that a scientist, I think, should and been to do properly. Yeah. And maybe my suggestion can be at the beginning, it's better to apply for small grants, to have more chance to learn how to write for sure, but also I was thinking access to get have more chances to have success. And then of course also increasing the ability in writing, but also maybe at a higher career stage with an higher CV, let's say, maybe it's also good to apply for a bigger grant. Yeah. I strongly believe in general in collaboration, so I also suggest to have kick-off grants or collaborative grants, to be in touch also with other colleagues and good idea. I think so.
So some advice.
I was doing this workshop actually, applying for the first grant. So I can tell you what I said. It's very important to know what you want to do and to look around, to search exactly funding bodies that are, that are giving money for covering that area. Once you know that you meet all the criteria and all the stuff, and there are people that can help you. In all the university, there is the grant office. Just go there with your CP, with your idea, and they will help you to understand if you are at the right stage, if you have the right CB, if it's too soon, it's too early. They can tell you and advise you on which are the grants that you are eligible for. And I totally agree that you don't need to kill yourself applying for a huge grant. That's the first thing. That's a work in progress. More you do it, more you learn. There are, at least in UK, I think it is very well structured. There are, for example, fund priming where you can apply to just get 10K and cover some experiments that then you can use to generate preliminary data and apply for bigger grants. That's very important because when you're in a lab, you need to have something yours.
And I think what again you're saying there, when you write a grant application, if you have some preliminary data, I mean, you're already far ahead of many others, right?
That's kind of one of the strongest things, because if you have good preliminary data and the kind of sensible and, logic proposal, they think, I was saying funders want to fund projects that will be successful. Yeah. Because you have good preliminary data and they go in that direction and you have a good plan to address that point. It was not easy, but it's going to be easier for you to be successful. Yeah. And then there are also early career fellowship. That means, you can start writing something, just getting some money for yourself or to cover your salary. But this helps you in writing, so learning how to write, and also in your CV, you can demonstrate that you were, able to secure some funding that is very, very good when you then apply for big.
Sure, exactly.
And feedback, don't write alone, I was saying, you think you have a research idea, but then when you start writing, you realize how many things you didn't think about. that maybe
We all have that.
something that it's not really connected what you were thinking, or some kind of technique is not actually doing what you wanted to do. So it takes much more time than you unexpected. So you need to give yourself enough time to write and send the application around to senior people that you trust. Give them the time to read it, get feedback, incorporate the feedback, and send.
That's very good. Do you have some kind of an internal review in your institution?
Yes. We do, and I use it. Usually, sometimes, you are
Too late yet.
but just because for financial stuff and this kind of stuff, you need to send it 1 month before. That for me, really a lot of time before. But I know that I have some people that I can
Rely on.
send it, and I'm not gonna send them the day before, but 2 weeks, 3 weeks before.
They can come with something.
In a week, I can come back. I can incorporate the feedback and then send it. But I would never send a grant without after get feedback to a senior person that I really trust. But it's a process, You need to start with something very big. You need to start step by step. This makes you also much more comfortable when you go.
What about you? You have different types of grants, maybe, or
Yeah. Yes, I agree totally with them, and I would suggest that for the youngest also to offer themselves to help the mentor, the PI, to write.
Yeah.
Whilst you are helping, in the same time you start to learn and acquire experience, and then you have the feedback with your mentor. So it is very important also to offer yourself in writing, in helping you run writing grants to your PI. Then when you have your own idea, that is the starting point, and the preliminary findings, of course, you have to try to find the grant that better fit with your profile, because this is very important. So really very well the call.
yeah, like that.
I don't even have read the call. What? Then so
Otherwise, it was made that
electoral. So there are some criteria, yes, that are well written, and
remember to fill out all the points.
and then already there is the structure of your the proposal of the structure of your proposal of the research plan, and you had to make an history of that.
So are you aware of the ESA grants?
Yes.
The ESA have some grants.
Yes.
Are you aware of them? Have you tried to apply to any of them?
Yes.
How was that procedure? And
I think it's very well organized. From my experience, yes, I applied for the EHA Advanced Research Grant this year. And basically, if you want to know the procedure, it's divided into different steps. I think, and this is in line with what Maria Paola was saying. The first step is if you are eligible, actually, because you applied, but sometimes you
are the wrong.
Sounds possible. So the first step is eligibility criteria. If you fit with the call. Then the second step is the internal revision of your grant, and then with a committee, internal committee of EHA members, and then if you are able to pass, and basically you will have a score to pass, you are eligible for external revision. And at the end, if you are lucky enough to pass also this third step, yes, the final step is an interview.
Yeah.
And yes, from my personal experience, it's very well organized. You know perfectly what you have to do. Of course, it's competitive, but yes, you can do it. Yeah.
Yeah. But I mean, this is so these these grants are obviously relatively difficult to get, right? I think we shouldn't sit here and say it's an easy task.
No,
I
it's
think
very competitive, yes.
like many other grants.
Yeah.
I'm thinking one last thing about grants. I think most of the grants that you apply to, do you show your CV and your name and so, or is it blinded? You know, I know some have blinded grants.
Try the night for anything where you don't show your CV or stuff. I'm not.
I think it's becoming more common that some bodies do. Yeah.
I'm aware about the grants that EHA has, and we are working on a collaborative project to apply for the collaborative one. To different places, in Europe, and that's very good. We think we need to work on the preliminary data, but in the future, it's work in progress. I have a perspective from British point of view. I work in UK, and we are struggling a bit because of COVID and because of Brexit. I know to say it's an issue at that moment. That's why I went for a starting package position and a permanent position, because London landscape is very terrifying in this moment.
Where I was going with these things about the blinded thing is, do you think it matters, but ask more directly, does it matter that you are a woman applying? Do you think women get as many grants relatively as men? Do you think this is a gender-ish? Is there a gender issue?
I'm not sure there is a gender issue in that. I'm more aware that women may not apply for something sometimes because we feel less confident in applying if we don't meet all the criteria. So sometimes we are giving ourselves.
So it's actually us.
We are not standing for ourselves.
We're not enough.
If we are not perfectly fitting with all the guidelines, maybe a woman say, okay, no, I'm not eligible. And on the contrary, from my experience, my male colleague said, oh no, okay, I try. I can fit it. Different the mood, I think, no?
So we're also not good enough at pushing ourselves forward, is that?
Yeah, I think so. I don't think there is a gender bias in that. I don't like to think that there is a gender bias.
I don't like to think that either, but I believe yesterday, you should read yesterday's Nature. There was an article about how that we are now just as many women as men in science, but the women do not get they don't, for some reason, get the best citations. They do not get into the best journal. They do not, and there's also...
That's a bias, right? We know, we are aware of that. I don't know if it exists in the grants, because then, when you go for an interview, you know the outcome, but you don't know...
You don't know...
you don't know, the direction. I've been lucky enough to get 2 grants that were from 2 charities in UK. We are basically all funded from charity in UK, and I'm a woman and I got them. So
You don't. You haven't felt it yourself. I'm not sure, actually. I'm asking because I don't.
I never felt myself like in a different position. I've had someone telling me you got the grant just because you were a woman.
Yeah, we all have.
And I need to say that this was not... I was like, what are you talking about? I don't think it's true, but, it's just some positive, different feedback and whatever. But I feel like I got what I deserved when I applied for things, and or I've been lucky, or things are improving, hopefully.
With that, I think we want to say thank you very much for participating in this we could go on in another hour about it, but we need to stop here, and thank you very much for your time.
Thank you.
Thank you.